heart attack is a condition that rarely occurs suddenly. In fact, the human body is capable of sending distress signals weeks or even months before this tragic event. Every year, a huge number of people face unexpected death from a heart attack, often unaware that their body is actively trying to warn them of the impending danger. Strange fatigue, brief chest discomfort, or sudden bouts of anxiety can all be silent cries for help from the heart, requiring immediate attention. Surprisingly, up to 80% of heart attacks could be prevented if the signs were recognized in time and appropriate measures were taken. Below are 8 key warning signs that may appear a month before a heart attack. Some of them may seem insignificant, but ignoring them can lead to fatal consequences. The first of these signs is often overlooked, although it may serve as a final warning before disaster strikes. Let's start with alarm signal number 8. Indigestion or heartburn. Many tend to underestimate heartburn, considering it just a minor digestive glitch triggered by a hearty feast, spicy seasonings, or excessive coffee consumption. However, what if that burning sensation in the sternum is not related to stomach problems at all? It is quite possible that the heart is trying to signal a much more serious threat. Stomach discomfort can serve as an early precursor to a heart attack, especially in those who do not experience typical crushing chest pain. The insidiousness of the situation lies in the fact that acid reflux and cardiac chest pain can be deceptively similar in sensation. Both can cause a burning or pressure sensation in the chest, and both can occur after eating. However, while heartburn is the result of exposure to gastric acid, cardiac discomfort occurs due to restricted blood flow to the heart, leading to oxygen starvation. The body does not always find it easy to draw a clear line between these two conditions. The heart and stomach share common nerve pathways, so in the event of heart problems, the brain may mistakenly interpret the signals, causing a feeling of indigestion. This is especially true for women, people with diabetes, and the elderly, whose heart attack symptoms often manifest in a more subtle form. How to recognize the moment when a harmless ailment turns into a serious threat? If heartburn attacks are accompanied by nausea, profuse cold sweats, sudden dizziness, or acute pain radiating to the jaw, upper limbs, or back, these symptoms should not be neglected. Such manifestations may indicate serious problems with the cardiovascular system, and delay in this case can cost lives. The 7th warning sign is unexplained weakness. Imagine a situation: you wake up in the morning feeling more broken than before going to bed, even after a long and seemingly complete rest. Suddenly, routine tasks such as carrying grocery bags or simply actively participating in everyday life seem like an impossible task. It is natural to attribute this to stress, age-related changes, or a hectic pace of life. However, what if this debilitating exhaustion is a harbinger of more serious health problems? This type of fatigue is fundamentally different from ordinary fatigue, which passes after rest. Instead, it haunts a person for days or even weeks, progressing over time. The patient feels completely exhausted even after performing elementary actions, such as taking a shower or making the bed. Some patients describe this condition as flu-like, but without fever or nasal congestion. The relationship between the feeling of exhaustion and the state of the cardiovascular system lies in the functioning of the circulatory system. When the main engine of the body, the heart, fails to cope with its task of pumping blood to the fullest extent, the flow of life-giving fluid to the muscles and brain decreases, which leads to a feeling of weakness, dizziness, and clouded consciousness. The body, trying to compensate for the deficiency, redistributes blood in favor of vital organs, which is why the limbs may feel especially weak and heavy. The worse the blood flow becomes, the stronger the feeling of exhaustion, even when a person is not subjected to physical exertion. Many people who have experienced a myocardial infarction have noted that they felt unusual fatigue a few weeks before this tragic event, but neglected this signal, believing that it was something insignificant. Don't repeat this mistake. The body sends signals, and it is important not to miss the moment when something can still be done. Another alarming sign is sleep disturbances. A person lies in bed exhausted but cannot fall asleep, despite the absence of anxious thoughts. Night after night, they toss and turn, sometimes waking up gasping for air or startled for no apparent reason. This causes irritation but is attributed to stress, age-related changes, or a disrupted sleep schedule. Sleep disturbances, especially difficulty falling asleep, frequent awakenings during the night, or feeling exhausted even after prolonged sleep, can be harbingers of impending heart problems. In common understanding, a parallel is rarely drawn between poor sleep and heart disease, but this relationship has deep roots. Disturbances in the cardiovascular system lead to difficulties in maintaining stable blood pressure and optimal oxygen levels, and these factors, in turn, directly affect the quality of nighttime rest. Of particular danger is the so-called nocturnal hypoxemia, a condition in which blood oxygen levels drop during sleep. This can be caused by a decrease in blood flow due to narrowed arteries, which makes it difficult for the heart to effectively transport oxygen. The brain, signaling a problem, causes microarousals, brief episodes of wakefulness that often go unnoticed but disrupt sleep structure and lead to feelings of fatigue during the day. Another underestimated factor is the role of the autonomic nervous system, which is responsible for the automatic regulation of vital functions of the body, including heart rate and blood pressure. In situations where the heart is overloaded due to blocked vessels or the threat of a heart attack, this system may be overactive at night, provoking adrenaline surges and preventing relaxation and the transition to deep sleep. This explains the cases of sudden awakenings, nightmares, or rapid heartbeat that can occur in people several weeks before a heart attack. The fifth alarming signal, unexplained shortness of breath. Imagine a situation: you are climbing a staircase, a route that you have done countless times, but this time something goes wrong. Suddenly, halfway up, you are overwhelmed by the feeling that you have just finished a marathon race. Your breathing becomes erratic. You freeze, trying to catch your breath, but air enters your lungs with difficulty. Perhaps this is simply a consequence of fatigue or lack of physical fitness, but it is possible that it may be a harbinger of more serious problems. Mild shortness of breath is often underestimated as an early sign of heart disease. Many tend to associate difficulty breathing with lung problems, such as asthma or a common cold, forgetting about the close relationship between the heart and lungs. When the heart has difficulty pumping blood effectively, the lungs have to take on an extra load to provide the body with oxygen, which leads to sudden shortness of breath. It is important to understand the difference between ordinary shortness of breath and that caused by heart problems. Feeling short of breath after an intense workout is quite natural. However, if you start to suffocate while performing everyday tasks, such as walking, climbing stairs, or even during a conversation, this is a serious cause for concern and requires immediate medical attention. Sometimes insidious shortness of breath overtakes a person even in moments of complete rest, forcing them to jump up in the middle of the night in search of a breath of air. The reason for this may be the accumulation of fluid in the lungs, resulting from inefficient heart function, a condition known as pulmonary congestion. The danger of this symptom lies in its gradual development. At first, there is a slight shortness of breath during physical exertion, but over time, even minor actions cause severe shortness of breath. Many neglect this, attributing everything to age-related changes or lack of physical fitness. However, when shortness of breath steadily progresses for no apparent reason, it often indicates serious heart problems that require immediate attention. Another alarming sign that cannot be ignored is pain or discomfort in the jaw or neck. Often these sensations are precursors to a heart attack, which unfortunately often go unnoticed. While most people are aware of the intense chest pain that accompanies heart disease, discomfort in the jaw is rarely associated with heart problems. It is important to remember that pain in these areas can be just as serious a sign, requiring immediate medical attention. Many people tend to underestimate such symptoms, not realizing that they may be a warning signal coming from the heart. Pain sensations associated with heart problems sometimes manifest in unexpected areas such as the jaw, neck, or even teeth. This phenomenon is explained by the absence of pain receptors in the heart itself, unlike the skin or muscle tissue. When the heart experiences increased stress, such as insufficient blood supply, it transmits signals through the vagus nerve. This nerve originates in the brain, passes through the chest, and reaches various parts of the upper body. As a result, the brain may mistakenly interpret heart pain as discomfort in the jaw or neck. Another complexity is the variable nature of these pain sensations. One day a person may experience mild jaw pain, while another day they may feel stiffness in the neck. Sometimes the discomfort may temporarily disappear and then return under stress or after physical activity. This inconsistency of symptoms can lead to their being ignored until the situation becomes critical. How can you recognize whether discomfort in the jaw or neck is a potential warning sign from the heart? If the pain sensations arise unexpectedly, differ from the usual, or are accompanied by additional symptoms such as shortness of breath, nausea, dizziness, or a feeling of exhaustion, these signs should not be neglected. If the pain intensifies with physical activity but subsides at rest, this may indicate serious problems, such as angina, indicating insufficient blood supply to the heart muscle. A third alarming sign is dizziness or a near fainting state. Imagine a situation: a person is going about their usual business, and suddenly the world around them begins to spin. A wave of dizziness washes over them, and balance is lost for a moment. Perhaps this is caused by ordinary dehydration or too abrupt an ascent. But if this happens repeatedly, you should pay attention. The feeling of dizziness, the feeling that you are about to lose consciousness, passes in a few seconds, and the person brushes it off without paying attention. But what if this short-term dizziness is not as harmless as it seems at first glance? One of the first warning signs of possible problems in the cardiovascular system may be a sudden feeling of instability or general weakness. Ignoring such signals is extremely unwise, as they may indicate that the heart desperately needs support. The heart performs a vital function, pumping oxygenated blood to all organs and tissues, including the brain. If blood flow is restricted due to narrowing of blood vessels or other heart problems, the brain may experience oxygen deficiency. This, in turn, manifests as dizziness or a pre-fainting state, even if the person has not been subjected to significant physical exertion. Some patients describe this condition as a sudden rush of weakness when the body seems to lose strength, while others feel a strange feeling of floating, as if the ground is slipping away from under their feet. Unlike dizziness caused, for example, by dehydration or a sharp change in body position, cardiac dizziness occurs spontaneously, without any apparent reason. It does not obey any logic and can overtake a person in any position, sitting, standing, or even lying down. How do you know when dizziness is a cause for serious concern? If episodes of dizziness recur for no apparent reason or are accompanied by other alarming symptoms, such as increased fatigue, shortness of breath, or chest discomfort, these signals should not be neglected. The body persistently warns of impending danger, and the sooner a person listens to these signals, the higher the likelihood of preventing the development of a life-threatening heart attack. The second alarming signal: unpleasant sensations in the upper back or shoulder area. A person automatically rubs their shoulders, trying to soothe the aching pain that spreads across the top of the back. Perhaps an uncomfortable sleeping position or sitting for too long has caused this. Rotational movements of the shoulders are made in the hope that the discomfort will recede, but this does not happen. Instead, the pain lurks, penetrating into the area of the shoulder blades and sometimes radiating into the arms. This condition is irritating, but does not reach an unbearable level. However, pain in the upper back or shoulders can serve as an early and often overlooked precursor to a heart attack. Unlike the sharp, piercing pain that occurs with injuries, cardiac discomfort often feels like deep, diffuse pressure or tightness. The reason is that the nerve fibers that transmit pain signals from the heart do not always direct them directly to the chest. Instead, pain impulses can radiate to other areas of the body, including the back, shoulders, neck, and even limbs. Certain categories of people are more prone to experiencing upper back pain as a warning sign of a potential heart attack. Women, patients with diabetes, and the elderly are more likely to experience discomfort in areas other than the chest. People with high blood pressure, high cholesterol, or a history of smoking are also at increased risk. If a person falls into one of these categories and notices unexplained back or shoulder pain, they should not ignore this symptom. In such situations, it is always wise to be vigilant and seek medical advice to rule out serious health problems. The first warning sign is mild chest discomfort that occurs episodically. This symptom, appearing and disappearing, is one of the most insidious harbingers of an impending cardiac catastrophe, which unfortunately often goes unnoticed. It is important to emphasize the intermittent nature of this sensation. Not always intense and not constant, it comes and goes, leading to the mistaken belief that there is no serious threat. However, behind this seeming harmlessness lie deep and disturbing processes. When the blood supply to the heart muscle is limited, the heart experiences oxygen starvation. This in turn makes it difficult for it to effectively pump blood. This condition, known as angina, does not necessarily manifest as acute pain, but rather as a feeling of tightness, pressure, or even heaviness in the chest. Unlike a heart attack itself, angina is temporary. The unpleasant sensations may last only a few minutes and then disappear without a trace when blood flow to the heart is restored. It is this brevity that causes many people to ignore this symptom. But this is the main danger. Angina is not just a harmless ailment, but a clear and unambiguous signal that a heart attack may occur in the near future. At the initial stage of the disease, a person may experience unpleasant sensations only during periods of increased physical activity, when climbing a mountain, carrying heavy objects, or even in stressful situations. These symptoms usually pass quickly at rest, creating a false sense of well-being and allowing the problem to be ignored. However, over time, as the arteries become more clogged, discomfort begins to manifest even with minor exertion. Ultimately, painful sensations can occur even at complete rest, and then the count can be in hours or even minutes before the heart is on the verge of its capabilities. The particular danger of this symptom is due to the fact that it does not always manifest as acute pain. Many patients describe it as a feeling of tightness in the chest, as if a tight ribbon is squeezing the body, as a heaviness pressing on the chest, a burning sensation that is easily confused with heartburn, a feeling of fullness or discomfort, resembling bloating, but in the chest area. It is noteworthy that painful sensations are not always localized in the chest. They can radiate to the arms, shoulders, neck, jaw, or even the upper back. If the discomfort becomes more frequent, prolonged, or is accompanied by symptoms such as dizziness, nausea, cold sweat, or shortness of breath, you should not postpone a visit to the doctor. By the time the pain becomes intense and constant, a full-scale heart attack may already be unfolding. Foresight and vigilance are the main allies in the fight for a healthy heart. Myocardial infarction, as a rule, is not a sudden phenomenon, but develops gradually as a result of many years of negative influences. However, it is within everyone's power to prevent this tragedy. Daily decisions have a direct impact on the state of the cardiovascular system in the future. Diet either contributes to the development of diseases or strengthens health. It is advisable to abandon the use of processed foods, trans fats, and excessive amounts of sugar. Instead, you should enrich your diet with whole foods, vegetables, lean proteins, and healthy fats, such as olive oil and fish. Each meal is an opportunity to strengthen and protect the arteries. Regular exercise is not just a way to maintain physical fitness, but also a vital necessity. The heart, being a muscle, weakens without sufficient physical activity. Even a 30-minute daily brisk walk can significantly reduce the risk of developing cardiovascular diseases. Prolonged sitting is highly undesirable, and this habit should be eliminated. Stress is a silent killer that has a destructive effect on the body. Chronic stress leads to increased blood pressure, narrowing of the arteries, and inflammatory processes. It's crucial to learn effective stress management techniques like meditation, deep breathing exercises, or setting personal boundaries. The heart needs rest and peace just as much as it needs oxygen. Smoking and alcohol abuse have a devastating impact on the heart from the inside out. Quitting smoking is a top priority, as each cigarette causes irreparable damage to the arteries. Alcohol consumption should be limited to moderate amounts. It's important to remember that negative changes in the body accumulate much faster than it may seem. Insidious ailments, like silent killers, such as arterial hypertension, high cholesterol, and diabetes, require close attention and monitoring. Regular preventive checkups with a doctor can be a life-saving beacon, detecting an impending threat in time. After all, without knowing the exact indicators of your health, it is impossible to effectively manage the situation and prevent undesirable consequences. Realize that the fate of your heart is not an inevitable sentence, but rather the result of meticulous work on yourself, shaped by your daily decisions and actions. Don't postpone taking care of yourself for later. Start acting today, because your prosperous future and many years of healthy life depend on it.